Hey guys, so I wanted to make a video to tell you guys what to look for if you are thinking of going into home health as a CNA or as a home health aide or even a nurse, really. Things that you should look for in whatever agency you are thinking of working for, um, because there's certain home health agencies that really are not good for whoever um, is working for them. Like, I have interviewed with a few of them, and you know, you have extremes from one to the other of like a really good agency with benefits for their employees and who you can tell actually care about their patients and things like that. But then you also have other um, home health agencies who you can tell just really want warm bodies, and they're not necessarily um, in it for actual patient care. And you can kind of tell where people's priorities are. Um, so, for example, the one home health agency that I worked for a couple weeks, um, that I ended up quitting, they were rushing me to get into it. They were basically telling me that I needed to start things, and didn't really even prepare me as far as like um, charting and the paperwork process, because none of their charting was online. It was all through the paper, and it was just really frustrating. Now, I had messaged them on Facebook, and they told me to come in for an interview um, like the next day or the day after, something like that. I think it was the next day. Um, and they wanted me to start within 2 days of that interview. And um, I think I ended up seeing two patients on three different occasions, and then I ended up quitting because I just the things that they did. Like, this one lady, they had me go to her house for a training shift, and basically what it was me just talking to her daughters and having listening to them tell me what it was that they wanted for their mom, which was basically like, I don't even understand why I needed to go, because they had a list of everything. Like, when I got there, they had all the food laid out that they thought that their mom would possibly eat, and like, they basically just said I need to be there to make sure that their mom didn't fall because she had had hip surgery or whatever. But I was just rushed into that. Like, the agency changed my schedule without even like giving me any notice. Um, it was just really frustrating. Like, if you tell me that I'm gonna have like a week in advance to know about the schedule changes, because that's what they told me in the interview, then that's something that you need to uphold. Um, they said that I was going to be getting paid almost $13 an hour, and they never paid me, which is ridiculous. This is like 3 months later, and they have never paid me. I never got any money for the 3 patient visits that I did, and it's really frustrating, but I guess it is what it is. You live and you learn. So I would say definitely, ask a lot of questions. Ask about their benefits. Ask about schedule changes, like if a patient needs to cancel, or if somebody like needs to call off of another case. Ask them, if they're going to change your schedule, or if they're going to give you notice if they need to change your schedule, or like how it goes when somebody else calls off of their case, um, because those are things that you need to know. Um, I don't know. Home health is good in the fact that you have one-to-one patient care and you're able to form a bond with people, but it can also be bad that you're one-to-one, because you could have a super combative patient and you're the only person there. Like, a lot of times with home health, it seems like it's with people who like they need somebody to care for their loved one while they're at work, or it's like an elderly couple and one of them or sometimes both of them need care. But with the people that I had, it was one of the couple needed care, so it was just one of them that needed care, the other one didn't. And it was just kind of helping the other partner. But you just really have to be wary of home health agencies and hope that you find a good one, because like I said, it's hard to kind of weed out the good ones from the bad ones. And as far as the things that I think are important is, like, if for some reason you can't get to a shift, you need to know, like, how that whole process goes, how it goes when you need to call off. Are you penalized for it? Can they, if somebody else calls off, can they just add you to that person's case and have you cover that shift? You know, can they just change your schedule without giving you any notice? How do they handle things like that? You need to know about benefits, time off, vacation time, because a lot of home health agencies, they pay a little more, but they don't give you any benefits. So it's nice, that you get a little bit of extra pay compared to like nursing homes and things like that. But a lot of times you're not really getting more because you end up having to pay for your own health insurance and things like that. But the one girl who I did a training shift with my first client at the home health agency, she was getting insurance through her husband, so she didn't really care that they weren't paying for insurance or anything like that. So I guess if you're in that type of a situation, it wouldn't be so bad, because you have insurance through your spouse. But obviously there's instances where, you need insurance. And I honestly feel like everybody should have insurance, but that's another story. So yeah, anyways, if you guys have any questions about home health and like pros and cons and things like that, I will make another video about pros and cons of nursing homes versus home health, because I did tell you guys in my recent Q&A that I was going to be making a video to talk about that a little bit further. I'm not working in the healthcare field anymore currently, so I can talk to you about that and why that is if you guys are interested in that. But yeah, hopefully you guys found some information helpful that I included in this video. And I'm sitting in the parking lot at Meijer right now, waiting for my husband because he's in there doing a job interview. Not for Meijer, but for the coffee shop that's inside of Meijer. But anyways, I will talk to you guys again soon.